The CDC reports for the first time lung cancer has surpassed breast cancer as the leading cause of death among women in developed countries. Shawn Tittle, chief of Thoracic Surgery at Norwalk Hospital, says every year he sees an increased number of lung cancer patients.
The die was cast when so much of the population started smoking, and now we have to treat it and take care of it. That's not to be judgmental about people who chose to smoke. It's just a consequence of the increased risk of that activity.
Studies showed lung cancer attributed to 1.6 million deaths in 2012, and although it had been a top killer of men since the 1950s, it reached its peak among women in the 1980s. The highest lung cancer rates found in women were in Northern America, Europe, Australia, New Zealand, North Korea, and China. Studies also show lung cancer rates are decreasing in men, but continuing to increase in women in Spain and Hungary.
About 60% of people polled have a negative view of lung cancer patients.
Lung cancer can result from more than just smoking. Environmental factors like pollution, asbestos, radiation, and secondhand smoke are other contributors. 58 million people in the U.S. are exposed to secondhand smoke, which claims the lives of 400 infants and 41,000 adult non-smokers every year.
If you grew up in a house with secondhand smoke and you develop lung cancer, you're still a cancer patient. You still deserve the best medical care and the best opportunity for survival that anybody else with cancer has. It's a real epidemic among women, particularly now. And I think that we need to get past judgmentalism and treat it.
Tittle says with improved technology, doctors can catch lung cancers early through a CAT scan, which can lead to an 85 to 90% cure rate.
It's a safe procedure with minimal radiation dosing that gives high quality images. The most important part of that over the past year is that Medicare, for instance, will now pay for screening for people who have a lung cancer risk due to their smoking history. And that's a huge deal because CAT scans for smokers will save as many lives or more as mammography for breast cancer.
Smoking still remains the leading cause of lung cancer for both men and women in the U.S. Tittle advises those who choose to smoke to do so outside of a home or away from an environment where non-smokers are present. In this Relevant studio, I'm Priscilla Lombardi.